Just to give some background to kind of people who would be listening and reading this, we're obviously here with Dr. Travis Miller from the Allergy Station. Again, thank you for taking the time out of your day to join us. And some background on him. I believe you're a California native who kind of received his medical doctor degree from UCLA School of Medicine. And after working at 2 high volume practices, that's when I believe you founded the Allergy Station, which is located in Roseville, California, which is an allergy practice that specializes in respiratory treatments, allergy and immunology, health and wellness, and along with a number of amazing things. So kind of turning the page a little bit, RPM, remote patient monitoring, as you know, kind of experienced this explosion of usage during the global pandemic, but to which, of course, there are many benefits to RPM, even beyond the current public health crisis. But in your opinion, what patient demographics are best suited for RPM?
All of them. I'll say that and then I'll clarify it, but I really think any patient is a potential candidate for remote practice management monitoring. The reason being, if you look at healthcare in our respiratory space, we're sort of in the infancy or toddlerhood of it. And it's good because we need these tools. But like diabetes, I mean, I was sitting at a hotel 5 years ago and parents were looking at their child's blood sugar on the continuous glucose monitor that she was wearing in a different state. And so that is a perfect example of how parents were using real-time data with their endocrinologist to manage pediatric diabetes or type 1 diabetes. And so there's other fields that are in front of us, in front of the respiratory segment, as far as endocrine and other things like that, neurology. I think there's a lot of applications that we're going to see come along in RPM. Clearly, the scenario I just mentioned where parents are trying to help children lends very well, partly because of the smartphone and the linking of smartphone with tremendous amount of data and symptoms helps when parents separate from kids because the parent goes to work and the kid goes to school, or the parents work from home and the kid goes to school, or whenever they're disconnected, it allows. But I think of it with like my parents. My dad had a very significant neurologic issue, and I think we're going to see inroads in that segment with neurodegenerative disorders, falls, things like that. So I think there's a lot of applications that are possible. So we should be open-minded when we think about RPM. And I think patients are really understanding the connectedness feeling of RPM too, and they're going to come to expect it. So I honestly think there should be very sort of brisk uptake of this with clinicians.
Yeah, absolutely. Yeah. So your practice, the Allergy Station, remains committed to your telehealth platform, which I believe you've been utilizing since around 2017 to kind of offer your patients peace of mind, speed of service and convenience. So what advice would you offer a physician that wants to start implementing digital health solutions into their practice?
Start, I don't want to say start small, start finite. Establish a goal, write out your goals of the project that you're going to implement, and make sure that they're attainable. You want to achieve success in the first go around. And so don't take a massive program that's overwhelming and has too many parts to it and things like that. You really want to stay focused in what your first group of goals are, and then try and check those off, and then go down to the next set of goals and the next set of goals. Because if you bite off too big of a chunk to start with, you may have technical issues, you may have communication issues with patients, you may have staff shortages, changes, training, and services that sort of create friction and ways for things to get off track. So the Aluna program, we were talking earlier about the fall of 2019. I mean, we say this still to patients and other practices that call, the ability to basically beta test this in sort of normal situations pre-pandemic was critical because we could work out some of the little kinks before they came bigger issues, and that was really nice. It made it less stressful on our team in the office, and so understanding that. But I would just keep your project finite, and write out goals that when you're working with your tech partner, that you're establishing timelines, and when you sort of can check off that you really feel proficient and things are moving along smoothly.
Absolutely. And kind of last but not least here, how do you think RPM, will evolve, at least the respiratory healthcare space, kind of over the next 5 years or so?
I think it's going to continue to grow, and I think it's going to continue to grow at a pace that we maybe not what your company would want, but certainly more than I think the market could predict. And the reason being, if you look, and I've been preparing some lectures and talks, that consumerism that I talked about is exploding. The thirst and the appetite for digital health solutions is probably on the order of trillions of dollars. When you look at the Amazons of the world, the Berkshire Hathaways, the JP Morgans, the other huge firms that are getting deeply invested in healthcare solutions that involve technology, that's what this is. We call it RPM, but these are healthcare systems and solutions that are driven based on technology. And the technology exists. We all have smartphones. So I really think the growth is going to be high. Unfortunately, I also read an article. It was by the publishers of the New England Journal of Medicine, which said that clinicians' willingness to adopt solutions rapidly is low, and that's unfortunate. And those two universes are going to collide, and clinicians need to be very alert to the fact it's not a question of if it's going to happen, it's a question of when. And I advise clinicians, I say, it's going to happen faster than we think. So be on the leading edge. Don't be the last person in, be somewhere in the middle or up at the front, because it's happening. It's here now. Patients are going to start asking for it. They're going to want it. Systems are going to use it. I think I saw that Medicare is actually getting involved in payment models now. And when Medicare does something, all the payers are going to follow. So there's a lot of momentum going into this space from a variety of entities. Pay very close attention and get on board.
Yeah, very well said.